Nearly half of American adults have high blood pressure, including an overwhelming percentage of Black Americans. Dr. Jennifer Cottle is here with some advice for everyone handling high blood pressure during this pandemic. Thank you so much for being with us, Doctor.
Hi, how are you?
I'm doing well, thank you. Let's just start there. Why is there a higher prevalence of high blood pressure amongst the Black population?
That's an excellent question. There are a number of reasons for this, but a few things that come to mind are genetic factors that may play a role, a higher sensitivity to salt that may certainly predispose some people to becoming hypertensive or have high blood pressure, and then a tendency to respond to antihypertensives differently than other groups of people. Regardless, however, we know that treating blood pressure is very important because uncontrolled blood pressure can lead to things like strokes and heart attacks. So that's why this comprehensive holistic plan to sort of address our heart health is really crucial.
And how should viewers address their heart health from home?
Sure. So there's a few things that we can do at home, which is excellent. Making sure that our refrigerator is stocked with fruits and vegetables, that we're eating healthy is certainly key. Also, making sure that we're exercising, even though we're in the middle of a pandemic, making sure that we're getting outside, getting some fresh air, some exercise is also quite important. And something that I think is a little bit unexpected that people may not think about is, I recommend people take stock of their medicine cabinets. A lot of people don't realize that some pain medications, over-the-counter pain medications, can actually either increase blood pressure or interfere with blood pressure medications they might be taking. Tylenol, for example, is the number one doctor recommended pain reliever recommended to for people with blood pressure for this reason, because Tylenol does not increase high blood pressure or interact with blood pressure medications the same way other over-the-counter medications can. So really, this constellation of things, the diet, the exercise, making sure that we know what medications we're taking is really important. And then we've got to talk to our doctor about all of it.
And what should patients with high blood pressure know about over-the-counter pain medications?
So really understanding that their over-the-counter medications for pain actually may interact with their blood pressure, or rather may affect their blood pressure by increasing the blood pressure itself or interacting with blood pressure medications that they're already taking. And again, that's something I like to say because people don't always think about it. So that's why, really not just thinking about prescription medications that you're taking, but thinking about over-the-counter medications, pain medications, all that stuff. You really got to think about it all and talk to your doctor about all of it too.
And what are some actions taking place to address Black American health disparities?
Right. Well, there are a number of health disparities. We know that African Americans are more likely to die from heart disease than Caucasians, and Black Americans 35 to 64 years old are 50% more likely to have high blood pressure than Caucasians as well. There are other health disparities, but that's one of the reasons why I'm proud to partner with Tylenol, who is working with local affiliates of the National Urban League to provide education and resources to communities that are disproportionately affected by high blood pressure. So this is really, really important to me. I think it's a really important initiative that I really know will make a difference.
And where can our viewers go for more information?
Sure. I recommend going to Tylenol.com, but I also recommend that everyone also talk to their doctor.
All right, Dr. Cottle, thank you so much for being with us. Really important information, and we appreciate you sharing it with our viewers. We'll be right back with more Midday Maryland right after this. Stay tuned.